Imagine a woman in her 70s walking into her kitchen. She bends slightly to pick up a dropped spoon, and suddenly she feels a sharp snap in her back. No fall, no accident, just a small movement. That single moment reveals a hidden danger that had been quietly weakening her for decades. That's osteoporosis. It doesn't scream, it doesn't warn you. It steals silently until one day, your bones can't take it anymore. Osteoporosis, often called the silent bone thief, is one of the most underdiagnosed yet life-changing diseases in the world. It literally means porous bones. Imagine a honeycomb. A healthy bone has tiny, tightly packed holes. But in osteoporosis, those holes widen and multiply, weakening the structure from within. You can't feel it happening. There's no pain as your bones slowly lose strength. Then, one day, an ordinary activity, sneezing, bending, lifting a bag, triggers a fracture. Now here's the staggering part. Osteoporosis affects more than 200 million people worldwide. In fact, 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporosis-related fracture in their lifetime. That makes it more common than heart attack, stroke, and breast cancer combined. And yet, most people have no idea they're at risk until it's too late. Let's look at a real story. In 1999, former U.S. First Lady Nancy Reagan suffered a broken femur after a fall. She was later diagnosed with osteoporosis. Her story shocked the public because it revealed that even high-profile, seemingly healthy people were at risk. But the truth is, osteoporosis doesn't care who you are. It can creep up on anyone. So who exactly is most at risk? Women, especially after menopause, are the biggest group. Estrogen, the hormone that helps protect bone density, drops significantly during menopause, making bones more vulnerable. But men aren't safe either. By age 70, men and women lose bone strength at nearly the same rate. Other risk factors include genetics, smoking, heavy alcohol use, poor diet, lack of exercise, long-term use of steroids, and chronic illnesses like thyroid disease or rheumatoid arthritis. But here's the scary part. Osteoporosis gives almost no early warning signs. You can be losing bone mass for years without knowing. The first real symptom is often a fracture, but there are subtle hints. Shrinking height, losing 2 inches or more, could mean your spinal bones are compressing. A hunched back, often seen in older women, is another sign. Persistent back pain might be due to tiny spinal fractures. If you've had a broken wrist or hip from a minor fall, that's a red flag too. So how do doctors catch it before disaster strikes? The gold standard is the DEXA scan, or dual energy X-ray absorptiometry. It measures bone density and gives you a T-score. A score of -1 to -2.5 means osteopenia, the early stage of bone loss. A score of -2.5 or lower means full osteoporosis. The test is quick, painless, and critical for anyone over 50, especially if you have risk factors. Now let's talk about the big question: what can you do about it? Is there a cure? Unfortunately, osteoporosis can't be completely reversed, but it can be slowed, managed, and in some cases, improved. First, lifestyle changes make a huge difference. Bones need fuel. That means a diet rich in calcium and vitamin D dairy products. Leafy greens, nuts, seeds, and fish like sardines are your best friends. Sunlight is essential for vitamin D, though supplements are often needed. Exercise is equally vital. Weight-bearing workouts like walking, jogging, and dancing strengthen bones, while resistance training builds muscle that protects your skeleton. Even yoga or ADI Chi help by improving balance and reducing the risk of falls. Remember, the biggest danger for someone with osteoporosis isn't the disease itself, it's falling. One small fall can cause fractures that change your life forever. When lifestyle isn't enough, medications step in. Bisphosphonates are the most common. They slow down bone breakdown. Hormone therapy can help women after menopause. Newer drugs, like denosumab, a monoclonal antibody, and teriparatide, a bone-building hormone, offer advanced ways to stop or even reverse bone loss. Doctors choose based on your age, risk level, and health history. Let's not forget the emotional side. A fracture from osteoporosis can be devastating. A hip fracture, for example, often requires surgery, long recovery, and sometimes leaves patients unable to walk independently again. In fact, studies show that 20% of older adults who suffer a hip fracture die within a year due to complications. That's how serious this silent disease can be. But there is hope. Take the story of a woman named Maria. At 65, she fractured her wrist while gardening. A DEXA scan confirmed osteoporosis. Instead of giving up, she changed her diet, started taking calcium and vitamin D supplements, and joined a senior strength training class. Within 2 years, her bone density improved, and she avoided further fractures. Her story shows that awareness and action can truly change outcomes. Osteoporosis has also shaped history. In ancient Egypt, skeletal remains showed signs of bone thinning. Even Hippocrates, the father of medicine, described hunchbacks in the elderly, which we now know were compression fractures. Today, science has advanced, but the battle is far from over. So what can you do right now to protect yourself? If you're young, build strong bones early. Peak bone mass happens around age 30. After that, it's about maintenance. Eat well, exercise, and avoid smoking or heavy drinking. If you're older, talk to your doctor about a bone density scan. Prevent falls by making your home safer. Install grab bars in the bathroom, keep floors clutter-free, and use good lighting. The bottom line is this: osteoporosis is silent, but its consequences are loud. Broken bones, lost independence, and shortened lives. But it doesn't have to be that way. With awareness, prevention, and treatment, you can outsmart the silent thief. So next time you stand tall, remember, your bones are holding you up day after day. Take care of them, because once they're gone for good. And strong bones mean a strong life.